all of our viewers/listeners. It's great to be part of Voice Global virtual conference. And my associates and I would like to thank Pete Erickson and the entire Motive organization for giving us this opportunity to talk about voice technology in healthcare. And as many of you know, our book is currently on sale on Amazon Books. Mention Teri Fisher's name and you get a special deal. The book has been out since March, and we encourage you to go out and pick up a copy. We need to feed our families. So with that, the title of the book is Voice Technology in Healthcare, Leveraging Voice to Enhance Patient and Provider Experiences. So before we start with the questions, I would like each of our panel members to introduce themselves and say a few words. And with that, I'd like to start with Dr. Pruthi.
My name is Sandhya Pruthi, and I'm a physician at the Mayo Clinic in Rochester, Minnesota. I'm currently the medical director for our Division of Health, Education, and Content Services. I was one of the co-authors, along with Teri, David, and Harry, on putting this book together, and really enjoyed working with our numerous collaborators to really create a very comprehensive book around voice in healthcare, not only enhancing both the patient, but the provider experience.
Thank you. Dr. Teri Fisher, Mr. Vancouver.
Thanks, Harry. Yes, my name is Teri Fisher. I am a physician and clinical assistant professor at the University of British Columbia in Vancouver, Canada. Very pleased, very honored as well, of course, to be a co-author for this book. I am a physician by day, I like to say, but a voice tech enthusiast by night. And I host a number of different podcasts, including the Voice First Health podcast, the Lexan Canada podcast, and a number of flash briefings. And it's actually one of the really nice things.
Do you want to open it?
Alexa just started talking, sorry. I just muted Alexa. So I'll go back a bit there. So I'm the host of a number of different podcasts as well within the voice tech space, Voice First Health and Lexan Canada. And one of the really nice things about our book is I've been able to bring in some of the content, some of the interviews that I've had with some of the really amazing thought leaders in our community, and bring some of that content to the book so that we have some thought pieces in addition to some of the interviews. So thank you.
Thank you, Teri. Dr. David Metcalf.
Thanks, Harry. It's so great to be back with you guys too. I miss you from our days of writing and collaborating together too. So this has been a really fun project, and it's one of a few in a series that we've gotten to convene some of the best minds around a particular technology topic in healthcare too, in conjunction with HIMSS, the Health Information Management Systems Society too. And this is part of a series that includes not only our voice technology and healthcare book right now, but also blockchain in healthcare, connected health, mHealth, and health innovations. And we really try and have a perfect blend of some of the top thinkers and the top doers in a particular community. And what I love about the book is that we had a chance to bring all these different voices together, literally and figuratively, and really have a book that is as much about the written word as the spoken word, and also having some real world cases to go along with that. So it's not only theory, it's the best of theory and what science and clinical evidence has to offer, along with some of the earliest innovations and most exciting use cases too. So that's why I was really glad to have some of our team that's been doing some really great production as well too, involved in the whole project too.
Thank you, David. And now the man behind the book, Michael Eakins, who, by the way, got a haircut.
Thank you, everybody, and I'm happy to be here too. It was an honor to be able to put this book together with you guys. It's an awesome book, and I'm really proud to have been a part of it. So, like Harry said, behind the scenes, I work in David's lab, and I'm our creative director, but I basically was responsible for art direction and putting together the book in all of its formats on Amazon and Apple iBooks and the print version as well. So thank you guys again for letting me do that for you.
So Mike was more than just a head of production and production lead for the book too, but he's actually a subject matter expert in his own right too, having helped with some major projects like Alexa enablement of whole wellness homes in our Lake Nona Medical City and over in Connected City and Tampa and a number of others too. So there's that hands-on element too, that not only takes the book, but kind of brings it to life with your own case studies as well as some of the other work too. So appreciate having Mike and the rest of the team at University of Central Florida's META Lab, the Mixed Emerging Technology Integration Lab, where we both sit when we're not sitting at home, right, Mike?
Yeah. Yep. I'm
Michael,
excited to
thank you
get back.
from all of us. Thank you.
Absolutely. My pleasure.
Okay. Thank you. I think many of you may know me from the Intelligent Health Pavilion at HIMSS. If you attend HIMSS the last 10 years, you probably visited our pavilion. It's a technology-centric pavilion. And really, it's a show within the show and a conference within a conference. If HIMSS had taken place this year, it would have been our third year demonstrating the use of voice in an iHome setting, but also the use of voice in a clinical medical setting. Unfortunately, the coronavirus came about and HIMSS was canceled. But it's great to be working with the team on voice technology. There are a lot of activities around the world with voice. I want to think that the US is ahead of everybody. But yesterday I was on a call with a group of hospitals in Germany, and I think they're ahead of us. But let me get into the questions. And I'm going to start by asking the group, what motivated all of us to publish the book? What was the impetus behind this? Dave, any comments?
Well, seeing the whole voice trend has been really exciting too. And then I love the fact that your past experience with the Intelligent Home and the showcase that you do every year really gives us a chance to see where the state of the art is too. But this book has brought together the community and with Teri, international community too, to pull together some of those best cases and the best thought leaders. And for me, just going to the Project Voice Conference and hearing from you guys, hearing from Amazon, and them seeing some of the other books in the HIMSS series and saying, we need you to do a book on how voice and smart speakers are changing the health landscape for the sick and the well, for the patient and the provider, and what that future holds. And I'm excited to be here with you guys today, even though it is under the cloud of COVID and stay at home and things like that too, because there's so many things that are new capabilities and capabilities we were just starting to look at that may really influence our outcomes and our future as we look at getting through COVID together.
Thanks, Dave. Teri or Sandy?
Sure. I mean, just piggybacking off of what David said there, the voice technology industry is, I believe, still at its infancy. And, you know, it's time for us to work together because there's so much potential for what voice can do for us in transforming the whole healthcare journey. A lot of what I am really excited about is how a lot of this technology is going to be able to really allow for personalized healthcare in the home. And to make that type of very transformative change in a system, it takes more than one person and it takes a whole community. And what was amazing about this book and part of the motivation for it was being able to bring all these different experts together. And so for those of you that have picked up the book or for those of you that will pick up the book, I mean, we cover everything in there. We've got people speaking about privacy and security to you know, how do you design for voice with a lot of use cases. So it was really all about an introduction to this industry, and already things have changed so quickly. So I see it as a foundation for people that want to get involved, and hopefully lots of people do want to get involved and help make these changes to our healthcare systems.
Hey, Teri, when can somebody buy the book?
They can buy the book right now if they want it. They can go check it out right now. And you know what? And I do want to acknowledge a lot of the authors. That's great. David's holding it up there. This book, although we've got the five of us here, the cover authors, and of course Michael's incredible contributions in terms of the production, the value of the book. It's incredible. But this book would not be here if it weren't for the over 30 different contributing authors that have made the book what it is.
Well
And
said. Well said.
if people want to learn, it's hard to list every single person here and all their contributions, because we would take the whole show doing that. But if they want to learn about it, then please, I've got their pictures, a little bit of bio and that sort of thing on the website at voicefirst.health.com/book, and you can see these truly are 30 of the world experts when it comes to the intersection of voice technology and healthcare.
So the other really fun thing I did, Harry, is I shared the book with colleagues at the Mayo Clinic, and I have received nothing but wonderful compliments about the depth, the comprehensiveness around this topic. And as Teri and David said, it's just the speakers that we would attend to and listen to at various voice conferences come together and share their knowledge and help us put this together into this book. Really made a difference for what people were looking for. Tell us everything about voice in the space of healthcare. And they found the book actually really easy to read, and also very helpful in future projects that they're looking at exploring voice as they try and advance in this space.
Thank you. Michael, any comments?
Just it was great to be able to read through and even as I'm putting it together, I'm learning from all these wonderful authors that we had contribute to the book. So it's a great experience to be able to see what was on the cutting edge and learn from it. So I feel like I got a little extra benefit having spent so much time working on the book from that standpoint. But I'm really I'm enthusiastic about the direction that voice is heading for a lot of different avenues, as Teri mentioned. So we're just scratching the surface at this point. I'm a big fan of sort of the potential that this offers. I mean, we have voice in everything from your car to a ring that you can wear on your finger. I mean, there's just it's everywhere, and it's coming fast. And so it's really cool to be able to sort of watch it unfold and get to be a part of that.
Thank you. Did any of you have an aha moment as we were putting this book together? Was there an aha moment for Teri or Michael or David? You're back on.
Go ahead, Teri.
You go ahead, Sandhya.
I think that the aha moment for me was around the whole privacy and security, and just trying to learn where there was so much advancement done already in this area. And there's a really great chapter by Nate from Tobar from Orbita discussing this. And I think that was really a helpful topic to have reviewed in such a really well done chapter on this specific topic that many people ask us about everywhere we go. What is the privacy and security issues around healthcare and voice?
Any other comments?
For me, I think one of the really exciting areas of voice is the whole idea of vocal biomarkers. And I know, Sandhya, you'll be familiar with that with the work that you've done through Mayo Clinic. I mean, the idea of being able to listen to somebody's voice and start to infer physical states, diagnosing diseases, mental illness, dementia. The list goes on and on and on. And what I find fascinating, the more I think about this, is I actually believe that voice is going to become one of the vital signs that physicians use, like the way we use temperature or respiratory rate or pulse, heart rate, and so on. What's interesting to me is that voice, by listening to a voice, we're going to be able to start to, like I said, infer diagnostic criteria. And in fact, voice is probably going to be the least invasive vital sign, because you don't actually have to touch the patient. You don't even have to necessarily be in the presence of the patient if there's a microphone. And we know that there's work being done right now. Numerous organizations are researching, for example, can you diagnose COVID-19 through voice. And that's going on right now. So, and there's a little sample David's holding up right there. Corona cough as well. So
cough vid for the sounds.
There you go. So that part is absolutely fascinating to me, because people are we going to be able to diagnose illnesses just from having a microphone in your home?
Yep.
Yeah, and Teri, you're humble not to talk about your own too, but I really like the VOICE acronym and your ideas around voice being the next operating system. And we're already in some ways there too. If you think about how much easier it is for many people to vocalize or to speak to their computer or their systems, rather than having to use all of the other things, keyboards, mice, controllers. Those are all the things that touchscreens, those are all the things that are easy, but voice is so easy that people can just ask for what they want and receive it in terms of medical information, medical informatics, links to systems, the ease of use of using this for biometric security tied in with those health considerations too. And you start to have, like what you said, Teri, that whole operating system. So in addition to the biomarkers and the fact that you not only have voice, but you also have your own exhaust and what that exhaust can tell you in terms of biomarkers too. Exciting work that you and Sandhya and the team of other medical professionals are doing in those areas that were part of our book. Those are all things that were a mix of aha moments for me, but if you put them together, that's where some of the magic is, I think.
You know, as a result of this work that we were doing in voice, I have to share, given that we were dealing with a hands-free world around COVID-19, Mayo Clinic actually did the next step of launching a voice skill on Alexa's Amazon's cloud to actually address this question that people had, using trusted answers to common questions around COVID-19 pandemic. And this is a voice-activated skill.
Well, that's a perfect segue, because my next question is, how is voice being applied to the coronavirus? And are there any examples, applications that you know of, maybe especially in telehealth, telemedicine? And I know, Sandhya, you've been active in that space.
I have. And so, yes, we're doing more telehealth now than ever before, just to address all of the patient care needs from their home because of the difficulty with bringing them into the clinic setting and those who were traveling from far. But I think this is a great example, telehealth and voice. But the work that we did with Amazon's Alexa really got some excitement around the fact that people didn't have to worry. They could ask the questions without having to log onto a computer about what are the symptoms of coronavirus? What's the safety issues around for my children, for my family? We put a lot of work into that, but that's a great example of what came out of the work that we did with the voice book.
Congratulations on that.
Thank you.
By the way, should I wear a mask or not?
Not now, but when you are out of the home, I would advise that you wear a mask, even when you go to the grocery store or to the shopping malls. I think there's still something of value there to having that mask, especially now as we're starting to figure out who is an asymptomatic carrier.
Thank you. Just another question around the book. What has changed since we compiled the book? Other than the impact of the coronavirus, have other applications taken place?
Yeah, well, this is David. I was going to actually show one that ties right into that too, with not only the idea of exhaust and breath in this case, but a actual COVID breathalyzer that some friends in Israel have come up with too, that we're looking at closely too. So hopefully you can see that up on your screen too, from Ben Gurion, University of Negev, that the Serubi brothers, in this case Gabby Serubi, has come up with this system that they've looked at, with blowing into a tube and having a spectrometer that can read from the chip in just within 2 days of you getting exposed. You can start to see, and it's over 90% accuracy on the testing too, and it takes about a minute. So those are some of the things that I'm kind of excited about too, that hopefully you were able to see on the screen for just a minute there as well too. So if that worked.
I think that's great. Are there any other examples that you may know of?
The thing that I'm interested in is the attitude and how more and more people, because they are at home, are becoming more comfortable with not only voice, but just telemedicine in general. The whole idea of using technology and embracing technology for their healthcare. You know, if there's sort of a silver lining in this, you know, myself and I've had these discussions with other colleagues, it's that this could be a very transformative time. And COVID-19 could very well be the catalyst that really moves us forward to embracing these technologies, whether it's the telemedicine, whether it is voice technology and people are in their home and they want to, you know, talk to the voice devices, or even when they're out and about, right? How many times now do you think twice about touching something or touching an elevator button when you could very well have a voice-enabled elevator system? You just talk to it, take me to floor 4. And so I think that this is actually very interesting from that perspective, how it's going to change our behaviors. And this is really a big transformative time.
So Harry, there is another thing that I think is really important to talk about in terms of voice and skills. We actually created another voice skill called a self-assessment skill on the same Amazon Alexa cloud, so that people could ask questions if they should be tested. And we get that a lot. And to be able to have a voice skill and have the self-assessment skill built into it is another advancement in this area around the whole COVID-19 and trying to get quick answers, who should be tested and when and what they should do about testing and how to get the right place, where to go for testing.
Sandhya, congratulations on all the content on the Amazon Alexa. It's great. I hope the community is using it.
I just thank our team. They moved quick. This was not easy to do. And I think this is just another example of where you had to move fast and build the content. Like you said, and a team at Mayo Clinic, they were fabulous, and we have a really good product out there.
Again, congratulations.
Thank you.
I want to focus in on some questions for each of you, and I'm going to start with Teri. Teri, from the time you and I got to know each other, which was about 10 and a half years ago.
Seems like it, Harry.
You've been pushing the whole idea of voice being the next OS. I agree with you, but share some of your insights for our participants.
Sure. So this is sort of yeah, David alluded to this a little bit earlier. So as I start to think about voice more and more and why it's so transformative, I started to realize that I think there were 5 main reasons, and I kind of played around with the words a bit, and I realized that if we take the letters voice, they could each stand for something that I think is a very important factor to consider when it comes to voice technology, and why I think it is the next operating system. So V, in my mind, V stands for versatile, meaning that voice allows us to do things, we can multitask. So there are not a lot of other interfaces, for example, texting, typing, swiping, that you can do while you're driving. But yet, of course, you can use your voice. It's the safest way to communicate when you're driving. Same thing if you're cooking or whatever it is, you can use your voice. So that's the V. The O is omnipresent, meaning that when you speak or when you listen to someone speaking, that sound is all around you. And you don't have to be looking at a page. You don't have to be looking at a screen. Somebody could call your name from behind you and you're aware of it. So that's what I mean by being omnipresent. Innate, I is for innate, and that is the idea that using our voices to speak, to communicate, is the very first way that we communicate when we're born. When a baby's born, baby cries. And so it is built into us. It is instinctual for us to use our voices to communicate. C, contextual. This touches again sort of on those vocal biomarkers to a certain degree, because what I referred to there is that you can hear emotion in my voice. And I often will give the example, if I'm speaking to my son, he could give me the exact same words, but completely different meanings. If he says, I had a great day today, or I had a great day today. You know, it's got 2 different meanings, but the words are the same, and it's very contextual. And that's something that you can't always pick up in something that's written. If you get an email, is somebody being sarcastic? Is somebody being pleasant? Are they trying to be funny? It's hard to know that. And again, along those lines, when you then expand that to the idea of healthcare, then you've got the contextual aspects of it, but in reference to does somebody have an illness? And then finally, the last one, E. E is for efficient. The average person types at about 40 words per minute. The average person speaks at about 150 words per minute. So when you think about that, 3 to 4 times faster on average, it's much more efficient. And we're all very sensitive with our time. Time is one of the most important assets that we have. And so if something can be more efficient as a way of communication, then I think that's very important. So for those 5 main reasons, I believe that voice is now the operating system, and we're seeing different companies, like the way we have a Mac OS and we have Windows. We're seeing Alexa, we're seeing Amazon Alexa, we're seeing Google Assistant, we're seeing Samsung Bixby, but they're all voice operating systems. And so that's the way we're going. That's the way we are right now, and it's going to continue to evolve.
Thank you for that great explanation. The next question is for Sandhya. Why are Mayo, Boston's Children, and many other healthcare providers investing in voice technology?
I think we've covered a lot of good information about how the voice technology is going to advance our healthcare experience. We all want to be more efficient in the way in which we practice and the way in which we interact with our patients or with our peers. And I think that if we don't think about how voice can make us more efficient in this clinical space and in the clinical practice and the meeting the needs of the patient, we're going to be behind. And the voice advancements are happening every day. And one great example that as we start to explore it, we're talking about even using voice in an emergency room setting. Patients are coming in, they have symptoms, and often once you rule out the emergent illness and you need to give them good information and education, you can put a voice activating device in an emergency room and have the patient ask questions to get quick answers and prompt answers to common questions such as what is a treadmill, or why am I going for blood work to look at troponin levels, or things that we often don't think about. But can you imagine the efficiency that would create for the emergency room setting to have voice activated devices in the clinic?
Great aid. That's great aid. Okay, one more question from my dear friend David. David, AI, how's it affecting voice? We hear a lot about AI, but tell us how is that happening?
Yeah, so it's exciting that we had some of the top authors talk about that within the book too. And it's not just voice, it's voice on steroids of all the other things that go along with it, the other technologies, whether that's the artificial intelligence that you would see that's simple in learning algorithms, that if it's the artificial intelligence that you can apply with voice in things like our, from the book, our robots, too, that are in the clinic too. So you start to be able to apply voice with other technologies, and even our cars too, some of the Teslas and things too. There's a smart AI algorithm. Your voice is the interface to activate that, and you supercharge and superpower that with the things that you get to. The examples that are most relevant right now is some of the Parisian University work that's being done with CoughVid too, to be able to have AI look at large data sets and see trends across that. And that could be anything from context to biomarker and exhaust to your own security as well too. Your voice is very unique to you too. And some of the ones I like best are those that are diagnosing or precursor to diagnosing some of the disease states too. And that's pretty exciting as well too, to see some of the things that can pick up a Parkinson's tremor before the ear of even a trained physician can pick it up too. But with these digital technologies, they can hear everything. And as you start to see that algorithmically over multiple patients, multiple cases, you can start to show trends. That leads us to predictive analytics, so that you're not only thinking about voice for what you can do now and in the past, but what you might do to help you with your future too.
So
Thank you, David.
as David was talking, Harry, I thought of how you could then use the same artificial intelligence and natural language processing to personalize that experience, so that we're not just being reactive, but we're being more proactive. And over time, does the voice activated device get to know you better?
Very well said. Very well said. Terry, Michael, any comments?
That's great.
Okay.
No, yeah.
Okay, Michael, I have a question for you, young fella.
Ready.
How is voice technology being incorporated into our daily lives, our professional lives, our personal lives, our family lives? How is voice transforming all of that?
Yeah, I mean, there's been a lot of things that have been mentioned, but I think that as we start to go through, it's sort of like you've seen it with smartwatches and things that have become more commonplace. And I think as everybody's touched on, sort of voice is becoming, it's just going to become part of our natural way of doing things, whether it's just using simple things to make a phone call, call insert name here, or, eventually telling our toaster to cook our toast at the perfect temperature 15 minutes before we're at home. That kind of thing is just becoming, as IoT in general just expands infinitely. I think voice is just going to end up being one of the primary interfaces that just gets us through our day, whether we're talking to a smart mirror or, again, like I mentioned, a ring or a watch or your car. It's that interconnectedness that's going to glue everything together. And it'll just be that natural way we just talk to things, just like the science fiction movies we've all, seen. We're close, right? I mean, I don't think I'm crazy by saying we're pretty close to a lot of that.
No, you're not crazy. If you're crazy, we're all crazy.
Hey, Mike, I actually brought home a couple of the examples of the smart jewelry that doesn't have to look like, geeky toys, but it can actually be, just like regular jewelry, and it starts to be on the go with you, or whether that's also the hearables as well, too, that are starting to change the dynamics. Really, really smart hearing aids and other things like that, too. That was an aha moment from the book as well, too.
Yeah, that was one of my better chapters in that book. Hey, I want to jump over to something that we're all concerned about, and we've talked about it briefly here. Beyond privacy and security concerns, what are the obstacles for broader adoption of voice healthcare?
Well, I do think that the privacy issues are some of the main things too, but there are some others too. Standards and integration, and then also kind of the walled gardens of some of the different voice interfaces. Very, very few tools can actually move across the Alexa and Siri landscape seamlessly too. And some of the platforms we reviewed in the book actually show that integration and those standards coming together too. I think that's going to be a key feature that's going to unlock a lot of capability, as is the ability for us to trust that speech technology too. And now that companies like Microsoft with Cortana have actually beaten some of the best capabilities for a human voice transcriber listening to dictation and be able to do that dictation with natural language processing, we're going to start to see that accelerate too, as people start to trust that.
Terry, any comments?
No, I think that's great. That's great.
What impact will voice have on aging in place and our population, our aging population, who have decided to stay in their homes and live an independent life? Will voice give our seniors a better, safer, longer lifestyle?
I absolutely agree that, Harry, that is the future. I think that is the population, our aging population, who are going to most benefit from the efficiency, the knowledge, and the convenience of having a voice-activated device to do more of what Terry started off beautifully describing, home health and care in your own home. And I think that we do need to continue to build more tools such as voice-activated devices for the elderly, and allow them to have that care at home.
Okay, any other comments as we wrap up?
No, I'll echo what Sandhya just said. That I think that is the future. Again, personalized, decentralized medicine. The voice assistant is going to be a key component to that, and it's going to begin to almost turn our homes into little mini medical clinics where you can start to have a dialogue with your voice assistant, and that's your first interaction with the healthcare system. And so whether that means reminding you to take your medications for the aging population, or reminding you about an appointment, or setting up an appointment for you, or telling you it's time to go to the doctor, or whatever the case may be, that's the first link to the healthcare system. And I think that's going to transform the journey.
Yeah. Voice is a key part of the smart home, but also the smart building, the smart car, the smart office, the smart clinic, and all of those components interacting together too, where you just say a couple of sentences and you have food delivered to you. You can talk to your social companion, avatar, AI, robots, who are helping you, or even your car to take you to where you want to go to, with some of the simplest commands and interfaces that don't require physical dexterity, vision, or long attention either. Those are all things that I think are going to make living and lifestyle and the health and wellness beyond the acute clinical care needs, continue and be ongoing into the future too. And I just wanted to say too, it's been great to see you guys today, and also to continue to work together with you too, even in these strange times too. And I'm so appreciative of the work we got to do together too, and hopefully the meaningful impact that it's going to have on society too, as we continue to look at how voice is changing the technologies around healthcare.
And I can just add one more thing. Think of what just happened in the last 2 months with social distancing and social isolation, and where the voice in the home could have become that partner or that companion, and be able to provide some good information, trusted information when patients needed it.
Very well said, Sandy. Very well said. Well, I want to thank our panel members. I also want to thank Pete Erickson and Motive. And we look forward to future educational sessions. And I want to wish everybody a safe and well month as we go into June. Remember to wear your face mask, and if you don't have one, I have a deal on them. Thank you, everybody.
Thank you.
For more information on the book, if people want to check it out, you go to voicefirst.health.com/book, and you can see all the contributing authors there and information about it.
Thank you, Teri. Thank you.
Awesome.